2014. And also we have constantly watched his words of caution during the COVID times, as he was one of the members of the task force of COVID. So, sir, today we'll start your lecture. Our chairman has some important meeting today at the Ministry of Education. So he's asked me to continue it, and when he's free, so then he'll take over. So, sir, I welcome you on behalf of UGC family to you and invite you for your lecture, sir. Over to you, sir.
Thank you very much. Good morning to everybody, and thank you to UGC for inviting me for their wellness lecture series. And I thought I would discuss something which probably is not that, not sort of, I would say, not known by or known to everyone. I hope my slides are visible.
Yes, sir.
So I'm basically going to discuss how things have changed a lot in lifestyle and health are two very important interlinked factors in today's life. Now, what do we understand by health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is the WHO definition, and it's important to understand it because just by saying that I have no disease does not mean that you're healthy. You have to be in a good physical, mental, and social state to really say that you are healthy. And I think that is very, very important in today's time where we have a lot of stress and other issues which have come up, especially post the pandemic. Now, if we look at what is happening over a period of time, and this is true for India also, that there has been a gradual decline in infectious diseases, but this has also led to increase in what we call non-communicable diseases and lifestyle-related diseases, and therefore there is a need to address them. So in the 90s, or about 100 years ago, in the 1900s, we had common diseases, which was pneumonia, tuberculosis, diarrheas, and heart problems, which was the more common cause of mortality and morbidity. And among heart diseases also, we had diseases which were like rheumatic heart disease or other heart diseases, which are related more to infections rather than to lifestyle. But now, as we move forward, we have now diseases which are related to coronary artery disease, cancers, non-infectious causes, bronchitis, airway diseases, and diseases of the elderly. And this is something which has happened dramatically in our country. And this is a paper which many of us contributed, which was nations within the nation. That is, our country is actually, although it's one nation, there are different states which behave differently. And there has been a transition heart disease in also the disease pattern in our country from 1919 to 2016. The red color that you see here, the darker the color in terms of red, the higher the burden of disease in terms of the CMNNDs, that is communicable diseases, maternal disease, neonatal disease, and nutritional diseases. And if it comes to a bluer side, it means that now the transition is towards non-communicable diseases and injuries. So in 1990, what we saw was that bulk of India, especially the central part of India, was dealing mainly with communicable diseases. Maternal and infant mortality was high. We were having nutritional diseases. One state had already done better, and that was the state of Kerala, which had already started controlling these diseases. But as we fast forward towards 2016, you will see that the red has disappeared and it's gradually being replaced by the blue color, which means that now we are seeing more and more of non-communicable diseases and injuries. It is estimated that by around 2004, 2006, the burden of disease in our country shifted from communicable diseases to non-communicable diseases. So in the 90s, 60% of our disease profile was communicable diseases, maternal disease, neonatal deaths, nutritional diseases, and this contributed to what is known as DALY's disability adjusted life years. As we look in 2016, this has come down to almost 32%. So it is actually almost half. But if you look at non-communicable diseases, from 30%, it has become 55%. That means the burden of disease has gradually shifted towards non-communicable diseases. So the pattern that we're seeing is that now we have cancers, heart disease, diabetes, coronary vascular disease, asthma, bronchitis, arthritis, and other diseases of the elderly becoming more and more common as compared to what we were seeing in the past in terms of TB, plague, diarrhea, syphilis, even other infections like measles, smallpox. Along with this, we're also seeing outbreaks and pandemics in this century. If one thing that has defined the last 22 years in terms of unexpected things, it's the outbreaks and pandemics. In this century, we've had an outbreak of SARS, MERS, we've had one more pandemic, the H1N1, the swine flu pandemic. We are still going through the COVID-19 pandemic, and have had outbreaks of Ebola, of Zika virus, and a lot of other things. So the last 20, or I would say last few years have been defined by two predominant factors. One is pandemics and outbreaks, and the second is the transition of disease from infection to non-infectious causes. And what is the reason for this, and what should we do to stay healthy in today's time? So why is this increase in these new infectious diseases and outbreaks that we're seeing? I think there are these four factors which are predominantly contributing to this. One is travel, trade, and connectivity. The other is growing urbanization, encroachment into new environments, which are predominantly, let's say, dominated by animals and other species, and the issue of global warming. Now, for most of history, humans have actually lived in small bands, isolated from each other. Even if you go back to your parents or grandparents, majority of them lived in the same town, in the same state, and would really migrate to other areas and would settle down in that area. But things have changed so dramatically. Now we have become a global village, and we move very rapidly from one area to the other. Within hours, we can go to one end of the world to the other because of flights. And if you look at airports, they look more like railway stations now because of the crowd that we see. And therefore, there is a lot of contact between people and flora and fauna from both the old and new world in this modern age. So as we travel, infectious disease will also travel with us, and that is how pandemics happen. COVID-19 started from China, has spread all over the world. Even monkeypox, which is basically a disease occurring only in Africa, has spread to various parts of the world because of the fact that as we travel, we will carry infection, and that infection then will cause a cluster in that area. The other important issue is urbanization. People have now started crowding, and there's a lot of movement from rural to urban areas. And this causes a strain on sanitation. It leads to breeding for vector-borne diseases like dengue, chikungunya, Zika. And this leads to more and more outbreaks of infection, even respiratory infection. For example, we saw a huge outbreak of COVID-19 in metropolitan cities, predominantly in Dharawai. And that was basically because of crowding and an environment which allowed infections to spread. Also, zoonotic contact continues to generate many epidemics. The last 22 years, I would say 95 to 99% of the outbreaks that we've seen have all had a zoonotic origin. They are viruses which have been there in animals or birds and have jumped species. SARS, H1N1, COVID-19, MERS, all have jumped species and have therefore become human viruses from being animal viruses. And this is something that has happened for a long time, cross-species transmission, because of animal trade, wet markets, deforestation, population density. A lot of infections which were actually seen in animals or birds have now moved on to humans. And that is why it's important for us to start looking at One Health. One Health is human health and animal health being looked at as one, and understanding that they are interdependent as well as linked to the health of the ecosystem to which we are all a part. So it's important that if we want to really prevent these infections, we start looking at how are we going to look at the health of humans or health of animals, health of plants, and the health of the environment, because they're all interconnected. And we should start looking at One Health rather than just human health. So having said all this and having given this background, how can I stay healthy and protect myself against these newly emerging diseases? I've already said that what we've seen in this century is this new outbreak of various infections which have traveled quickly from one part of the world to the other. I think the strongest and most effective weapon that society has against this new emerging infection is the prevention of its spread. Remember, nothing else will work. Vaccines will take time, antiviral drugs will take time. If we can contain the infection, if we can prevent it, if we can have measures, in terms of prevention, we are in a much better position than ever before. And the pillars of prevention for respiratory infection remains the same, the three ones that we've been now talking extensively for almost 2 years: maintain social distancing, hand hygiene, and to wear a mask so that you can prevent the spread of infection. Respiratory infection spreads through contact, through surfaces, through aerosol, and through droplet infection. Droplet infections are in particles which are larger in size, cannot stay in the air for a long time, settle on surfaces, and therefore surfaces become important. Aerosols are particles which are less than 5 microns, stay in the air for a long time, and can therefore be inhaled by people because they stay suspended for a longer period of time. COVID-19 is predominantly a droplet infection, but also has aerosol spread and therefore can stay in indoor environment if there is not good cross ventilation for a long period of time. So how should we protect ourselves? Hand washing is something which is very important, and this is something that we've been sort of talking for centuries, but gradually over time it has become less and less. We don't wash our hands as frequently as we should. Hand washing with soap and water is good and as effective as hand washing using alcohol-based hand rubs, although alcohol-based hand rubs are more convenient to use. How do we wash our hands? And I think despite saying that this is something we've talked for a long time, this is something that we still don't do properly. And therefore, I would just like to show a video that we had made long time back as to how to wash your hands.
आपको लगभग 40 से 60 सेकंड लगेंगे। गहने, घड़ी और अंगूठियां निकाल दीजिए। पहले हाथों को पानी से गीला करें। अब साबुन दोनों हथेलियों में अच्छे से मलें। अपने बाएं हाथ की हथेली की ऊपरी सतह से दाएं हाथ की हथेलियों को मलें। ऐसा दूसरे हाथ के साथ भी करें। अपनी उंगलियों से दोनों हाथों के बीच में मलें। अपने हाथों की दाएं और बाएं हथेलियों को आपस में मलें। अब अपने बाएं हाथ के अंगूठे को दाएं हाथ से घुमाकर मलें। ऐसा दूसरे हाथ के साथ भी करें। अपने बाएं हाथ की हथेली की मुट्ठी बनाकर अपने दाएं हाथ की हथेली के ऊपर रखकर पीछे से और आगे से मलें और ऐसा दूसरे हाथ के साथ भी करें। हाथों को साफ पानी से धोएं और सूखे तौलिए या पेपर टॉवल से सुखाएं। नल बंद करने के लिए उसी तौलिए का इस्तेमाल करें। आपके हाथ अब साफ और सुरक्षित हैं। हाथ धोने
So hand washing is very important. Along with that, it is important to cover your mouth and nose with a mask. Mask protects us from getting infection when we are in office, workplace, or congested place. And it is also meant to protect other people in case one is infected. Everyone should wear a mask in public setting and when around people, especially when other social distancing measures are difficult to maintain. I know that this has come down a lot during the last few weeks, but we are seeing an increase in number of cases in 5 districts as far as COVID-19 is concerned in 5 states. And it's also important to understand that masks protect us from many other illnesses like TB and also have protective effect against pollution. Now, why is it important for everyone to wear a mask? And this is a classical diagram which suggests that if you are infected and but still asymptomatic, if you don't wear a mask, you are throwing a huge amount of infection in the environment. If someone else who is healthy is wearing a mask, he is protected. But if a person is not wearing a mask, so you are also not wearing a mask, the person is not wearing a mask, there is maximum exposure. If both individuals wear a mask, that is the one who's infected and asymptomatic and the one who's healthy, then the chance of infection is less. And that is the ideal situation that we should be looking at to prevent the transmission of viral infection. Also, it's important to remember that there have been a lot of studies which show that infections can spread to a large distance. The large droplets quickly settle. If a person sneezes, aerosol infection can even go up to 6 meters, but bulk of it really stays around 2 to 3 meters, and large droplets also settle within 2 to 3 meters. On coughing, again, large droplets settle around 2 meters, and aerosol can stay for up to 3 meters. Even while you're talking and exhaling, some degree of large droplets can be there for about a meter, and you can have aerosol also. So it's important for us to understand that it is something that is protecting us and the people around us as far as infection is concerned. Always cover your mouth and nose with the tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your elbow, not in your hand. Do not spit. Spitting itself can also lead to infection. Throw used tissues and immediately wash your hands. So you should always cover your cough and sneeze because that will decrease the chance of infection spreading. And again, I like to show a video as to how you should cough and what is wrong and what you should not do.
And right etiquettes of coughing and sneezing. First, observe social distancing of an arm length. Use handkerchief or a tissue paper to cover your mouth so that droplets does not reach the people around you. If you do not have a handkerchief or tissue, use your upper sleeve or inner aspect of elbow to cough or sneeze. If you use your bare hands to cover your mouth while coughing or sneezing, wash your hands with soap and water. The right cough and sneeze etiquettes will prevent spreading of any form of aerosol into the air or the environment around you. This video.
The next thing is to avoid touching your eyes, nose, and mouth, because when infection are there in your surfaces because you've touched some surface, then they can quickly spread to your throat by touching your eyes, nose, and mouth. So try and avoid that as much as possible. Social distancing, like I've said, is important. I think the better term is physical distancing, which means keeping a safe distance between yourself and others so that you are not exposing them to the infection. Practically, what we say is at least 6 feet or 2 arms length from other persons in public and outdoor places. And physical distancing should be practiced in combination with other preventive actions. And that is important to keep in mind. Again, it's better to say namaste, fold your hands rather than shaking hands, because again, you can cause the infection to spread if you shake hands with strangers. And this is something that we should avoid. Also, please monitor your health daily. Be alert for symptoms. And if there are any symptoms, you must get a checkup done. If you have any symptoms, take your temperature, but make sure that you don't take your temperature within 50 minutes of exercise, 30 minutes of exercising, or after taking medication that could lower your temperature like paracetamol, because that may give you a false sense of having no temperature or having high temperature. And also follow the testing policies. So this is one part that we need to look at as far as outbreaks are concerned, which you're seeing more and more in the last 22 years. The second issue is that like I discussed in the beginning, that we're also seeing a change in disease pattern. At the turn of the century, diseases such as heart disease, cancers, and obesity have become more and more important. And although communicable diseases like tuberculosis have not been eradicated, they have become significantly less. Pollution and climate change are also playing a major role as far as these non-communicable diseases are concerned. And it has been estimated that the steady increase in our life expectancy that has been seen since the late 1990s may soon slow down or be reversed because of these non-communicable or lifestyle-related diseases. So why has this pattern changed? This pattern has coincided with the shift in our lifestyle. Computers and phones have become more easily available. Children have switched from playing outside to video games and television. We have actually had a reversal. In our childhood, children would be playing outside and they had to be pulled inside by the parents. Now the parents have to send their children outside to play because they keep on staying inside. And internet has become a sensation and lives have been made easier. So we have to look at lifestyle related diseases. What is a lifestyle related disease? Any disease that is affected majorly by a person's daily habits and their lifestyle become lifestyle related diseases. This can be related to unhealthy behavior and other factors. And lifestyle diseases basically are caused by habits, by our behaviors and our practices. It's important to remember that when we look at lifestyle diseases, we as adults have a lot of factors which influence the disease profile that we have. It could be genetics, it could be the diet that we eat, it could be the physical activity that we do, development that happens during early life, and fetal programming. All of these lead to a large number of diseases, from obesity, arthritis, diabetes, respiratory diseases to metabolic syndrome. So what are the causes of these lifestyle diseases? Stress, genetic factors, obesity, smoking, unhealthy diet, and lack of exercise all cause these factors. And some of these are issues that we can address, and we can live a healthy life if we really seriously address these issues. So unhealthy diet and lack of physical exercises are two very important factors. What are the consequences of modern lifestyle? We are having more and more of lethargy, and there's lack of physical activity and exercise. There's unpredictability, and this leads to disturbed of the body clock. Our circadian rhythm gets disturbed, and it alters our metabolic function. We are becoming more and more busy, and there's inability to take out time for ourselves. Our diet has become unhealthy. There's insufficient nutrients and micronutrients, more stressful, more anxiety, which is has a counterproductive effect on our performance. And because of the available of so many gadgets, there is a lot of social isolation which have started happening, and the lack of communication is something which leads to delay in diagnosis and delay in understanding the problem that the person is having. So there are certain factors which are controllable, and these are factors that you need to realize are important: our diet, our body weight, our daily levels of physical activity, and smoking and alcohol abuse. There are certain factors which are uncontrollable, and we really can't do much about them. Age, as we go older and older, certain diseases like arthritis, neurodegenerative diseases become much more. And these are something that we have to try and see how we can minimize them, but they will be something which we cannot totally control. Gender also, there are certain diseases which are more common in men like heart diseases, but there are certain which are more common in women like breast cancer. So these are something which we cannot really do much about. Ethnicity, there are certain diseases like heart diseases is seen much at a much earlier age group in Asian Indians as compared to the Western population. And there are hereditary factors which predispose, whether it be heart disease, diabetes, or other illnesses, which are basically hereditary in origin. One of the major factors which is causing our current increase in disease profile is a sedentary lifestyle. And it is a lifestyle which is most commonly found in modern cultures and is characterized by sitting or remaining inactive for most of the day. It is a factor in obesity and other disorders. Sedentary lifestyle can be designed as a lifestyle of inactivity in which a person fails to participate in at least 20 consecutive minutes of exercise 3 times a week. The Center for Disease Control and the American College of Sports Medicine recommends that you should do at least 30 minutes per day of moderate intensity exercise 5 days per week, or vigorous intensity for minimum of 20 minutes a day for 3 days per week. And if you do not do that, then you have a sedentary lifestyle of physical inactivity. What are the problems? Why is it important for us to exercise? Sedentary lifestyle is one of the 10 leading causes of death and disabilities in the world. Lack of exercises increase the risk for, or doubles the risk for cardiovascular disease, for diabetes, for obesity, high blood pressure, osteoporosis, and even for cancers like colon and breast cancer. So it's important for us to move away from a sedentary lifestyle to regular physical activity. The next thing is to avoid addiction, smoking, alcohol, and drugs. Again, something which is being seen more and more common in society. There is data which suggests that smoking actually in women is increasing now in our country as compared to what we were seeing in the past. And smoking is related to many diseases. I see so many people who have respiratory problem because of smoking. Heart and circulatory system are related to atherosclerosis, and heart attacks are much more common in smokers. Strokes is common in smokers. Eye and vision problems are seen much more commonly in smoking, people who smoke. More than 10 cancers have been directly linked to smoking. And if we want us to give up smoking, you could at least decrease the risk for more than 10 cancers. Osteoporosis, fetal damage, and facial wrinkling, all are smoking related problems. This is a report, and I think it's a very important statement that was made by in the WHO report, that tobacco is unlike other threats to global health. Infectious diseases do not employ multinational public relation firms. There are no front groups to promote the spread of cholera. Mosquitoes have no lobbyists. Smoking has all of this. There are lobbyists, there are front groups, and there are multinational public relation firms which promote the use of tobacco. And that is why the challenge of tobacco and the problems that tobacco causes are huge, because there are, let's say, groups which promote it very, very aggressively, unlike other infections. It has been estimated that 4.9 or 5 million people die every year because of smoking. 13,000 people die per day and 560 people per hour. And this will increase by 2030 to 10 million people a year will die from tobacco use. And 70% of these deaths will occur in developing countries. And if you look at the type of tobacco used in our country, if you go to any shop, the most colorful part of the shop is where tobacco is being sold, whether it be the pan, masala, the tobacco in chewable form, or whether it be cigarettes, that it is shown in such a colorful manner that it is attractive to the younger generation. In our country, tobacco, which came from outside, we would, in history, if you look at it, smoking actually was introduced by the traders that came to India. But now we have smoking in so many forms. We have bidis, cigarettes, cigars, cheroots, chutta, dhumti, pipe, hooklies, chillum, and hookah, all being used in our country. And smokeless form of tobacco also is used in a huge form, from pan with tobacco to issues like gutka, and so many other forms of tobacco are available in our country. It has been estimated that an average of 11 minutes of life is lost for each cigarette smoked. In India, one person dies every 40 seconds because of tobacco-related problem. And overall mortality rates among smokers are 60 to 80% higher than non-smokers. In developing countries, 55 to 80% deaths due to chronic respiratory diseases and almost 25% of deaths due to heart disease are related to smoking. So there's a huge burden of disease as far as smoking is concerned. Why are we not able to control this, and why are people not able to give up smoking? I think it's also important for us to understand that smoking has been defined as a chronic and relapsing condition. I have many people who gave up smoking for 2-3 months, but again started. So it's a relapsing condition. Genetic and environmental factors contribute to smoking initiation and persistence. But it's important to remember that nicotine is not carcinogenic, but a potent CNS drug. It is linked to dependence. And nicotine dependence is what causes the problem in terms of people not being able to give up smoking. It is as addictive as cocaine, amphetamines, and opiates. When you stop smoking, or nicotine dependence leads to withdrawal symptoms. Symptoms appear between 4 to 12 hours after cessation, and people have insomnia, irritability, dysphoria, anxiety, anger, restlessness. There is weight gain, poor concentration. Some people argue that bowel habits become altered. They're not able to go in the morning and clear their bowel habits unless they have a smoke. Therefore, we are up against a powerful addictive drug, and that's why it's very important for everyone to help people who have got addicted to smoking, and try and also make sure that people don't get into the habit of smoking. Passive smoking, again, is being shown to be linked to all of these problems. And this is something also that we need to really address, whether it's in the home or in offices, especially when we're looking at younger generation, because their exposure to passive smoke can lead to harmful effects in later life. So I would really say that another mantra that we should have is choose life, not tobacco. Moving on to another issue is sleep. How important is sleep in today's lifestyle, in today's lifetime, when we start looking at health and lifestyle? Now, sleep has always been fascinating as far as man is concerned. We spend over 1/3 of our lives asleep. Never even think about it, but 1/3, 33% of our life is spent sleeping. And that time is when the brain is still active. Good sleep hygiene is essential for overall physical and mental health. And lack of good quality sleep actually has significant safety, economic consequences. People go off to sleep while driving, which has led to large accidents in highways. And therefore, sleep deprivation can cause major problems. So the question is, how much sleep do we need? And this is an important question. It varies. And in children, infants need a large amount of sleep. Newborn sleeps for a very long period of time. Most adults need between 7.5 to 8 hours of sleep to function well, but this is a range. There's no permanent one number, and about 10% require more or less sleep. So you have a 10% variation in this number, and pregnant women need more sleep. Now, how much sleep is enough? And this is something which has been studied a lot. We are not alike. A normal person sleep can vary from 5 to 10 hours. And there are genetic influences that are very important, and this needs to be understood. There are some studies that even suggest that the phase of the moon affects sleep duration. Medication and illness influence sleepiness and alertness, and regular or markers of sleep deprivation is basically those who use an alarm clock to get up because they're otherwise not able to get up. More than 1 hour difference in weekend and weekday sleep time is also something which suggests that we are sleep deprived. And excessive caffeine use to stay awake is another marker that says that you are actually sleep deprived. Common symptoms of sleep deprivation are fatigue, mood change, memory problems, difficulty in concentration, paranoia, and hallucination. All are features of long-term sleep deprivation. Are we as a society sleep deprived? And I think this is something that is important. If you look at data, the total sleep time has fallen from 9 hours in 1910 to about 7.5 hours now. Percentage of population acquiring less than 6 hours of sleep at night continues to increase. And in 2006, the Institute of Medicine of the Medical Academies declared sleep deprivation as a public health problem. An estimated 50% of Americans are sleep deprived, 30% average less than 6 hours of sleep, and it's estimated that 70 million people have insufficient sleep in the US. 7 out of 10 have trouble sleeping. 40 million suffer from long-term sleep disorders, and one in every 3 of Americans have symptoms of insomnia. So there is actually a cumulative effect as far as sleep is concerned. So another important issue is that it's important, if you want to have a good lifestyle, that we must make sure that we get regular, good quality sleep. And that is something that we need to really understand. Then coming to obesity, there has been a dramatic increase in the prevalence over the last 20 years, and we are becoming more and more obese. And this is also a lifestyle related problem. Now, obesity, when we talk of, we look at BMI, and BMI is weight in kgs divided by height in meters square. A normal BMI is less than 25, and if your BMI is more than 30, you are obese. In India, we don't look at BMI that much. We also look at what is known as waist-hip ratio. That's because Indians tend to develop obesity more around the trunk. That is, they have truncal obesity, they have a big belly, but their arms and legs remain thin, and they do not get fat all over their body as the Western population. And that is why a lot of us look at what we call waist-hip ratio rather than just the BMI. Why is it bad? Why is it a problem if you're obese? Actually, adipose tissue, or the fat that is there in the body itself, is what we call a pro-inflammatory stage. It causes more inflammation in the body and leads to many problems. It can lead to stroke, it can lead to sleep apnea, heart problems, lung diseases, fatty liver. It can lead to what is known as PCOS, polycystic ovarian disease in women with abnormal fertility and infertility and other problems. Because of the increasing weight, it can lead to arthritis in the legs and also gout and inflammation of the veins. Cancers have also been associated with obesity, and that's an important thing to keep in mind. Another important issue is obesity and what we call obstructed sleep apnea. So obesity also contributes to sleep-related problems, and this is one form of sleep disorder breathing that is being seen more and more because of obesity. It is unrecognized. One of the common symptoms is people tend to snore a lot at night. If you have someone who is obese and snoring loudly, he should be evaluated for OSA. Because of the fact that they don't get good quality sleep, they tend to doze off while doing monotonous activities, and this is associated with significant morbidity and mortality. There is now a strong link between obstructed sleep apnea and many systemic diseases, including metabolic syndrome, hypertension, daytime somnolence, heart disease, cardiovascular, cerebrovascular disease, and diabetes. And it's important that we really understand this, because we are seeing more and more of sleep apnea. And since this is an area of my interest, we are seeing that this is linked to fatty liver, it's linked to diabetes, it's linked to poor control of hypertension, and it is actually grossly undiagnosed in the general population. So the key to good health is, like I've said, weight watch, daily walks, take the stairs rather than the escalator or the lift, have a good sport like cycling, swimming, jogging, or tennis, or badminton, and maintain a healthy diet with fresh fruits, green leafy vegetables, avoid a lot of fats and carbohydrates. So key to good health is nutrition, exercise, avoid addiction to smoking, alcohol, and drugs, protect yourself from disease, like I've already said, especially now that we're seeing so many outbreaks, get enough sleep, and learn how to manage stress, do some degree of meditation, yoga. All of that helps in terms of good quality life. So way to good quality life is, if you smoke, make quitting your priority, reduce fat and cholesterol, do aerobic exercise 3 to 5 times a week, emphasize on fruits and vegetables in your diet, and avoid regular intake. If you do this, I'm sure that you will be able to stay healthy in today's time, and you will have a very good quality as far as your lifestyle is concerned. So have a good quality life, get your cancer screening done. Now this is being done very aggressively by the government itself. So whether it's oral cancer, breast cancer, cervical cancer, screening should be done. Eat less meat, get enough sleep, relax, and be an optimist. Thank you very much.
So thank you so much. Your slides, they highlighted to have a good quality of life, you should have enough and good nutrition. Also do well exercise, do walking, and then several types of good forms of yoga and other practices. And also do have enough sleep, because this is very important, sir, because people, they stress upon the sleep and they reduce the sleep cycle in their lifestyle. And also to manage stress, you have highlighted that. And also you have given a voice to be relaxed and to be an optimist. So, these are the key takeaways from your lectures today. But sir, we'll hold you back for a few questions which are on the Twitter, and those are very important, and those are really the viewers have asked us that what is the long-lasting health consequences of COVID, sir? Some term is called long haulers. What do you mean by that, and what is the consequence of that? So we want to know from you, sir.
Thank you very much. I think it's a very important question, because we have the term known as long COVID or post-COVID sequelae. When COVID came 2 years ago, most of us thought it is a viral pneumonia and it will cause infection. You get treatment, you become all right, and then that is the end of the story. But gradually people started realizing, and this was realized more by patients than by the doctors, that you don't become all right even when you recover from COVID. Many people have symptoms even after that. And this became something which was put up on the net. Groups were formed, and we then decided, physicians started looking at it more critically. And this led to what was known as the long COVID or post-COVID sequelae. Most people, almost 60% or one data suggests that 60 to 70% of people who recover from COVID have some post-COVID problems which can last for up to 12 weeks, 3 months. And majority of them usually come out of it, but some will continue to have COVID, long COVID or COVID sequelae. And a recent paper suggests that it can even last for more than a year. Now, what are the problems that you can have? What has been shown is that the common problem is what is known as chronic fatigue syndrome, a feeling of tiredness, not being able to come to work, body aches, brain fog, that is unable to concentrate for a long period of time, sleep disturbances, not getting good quality sleep, insomnia. And then some people have joint pains. There are a few of our patients who continue to have a higher heart rate. Their heart rate, which was normally 80 to 90 per minute, now is around 110, and that causes them to be having some problem. So these are what we call long COVID symptoms. We are learning about them. The treatment is usually symptomatic, and good lifestyle, green leafy vegetables, fresh fruit, medication, and trying to maintain a healthy sleeping habit is something that we do. Sometimes we do need to give some medication also. There's also a group of patients who have damage to various organs because of COVID, lung fibrosis, heart problems, strokes, and for them rehabilitation becomes more important. Many hospitals, including ours, have now set up what we call a post-COVID clinic, where we try and address these problems, which also include issues of mental health. And I think it's getting more and more important that as we move away from, as we start having less COVID cases, we are having an increasing burden of post-COVID sequelae.
Thank you, sir. Thank you, sir. One more question is from a YouTube viewer who says, how to overcome fatigue after having COVID-19?
So fatigue after COVID-19, like I said, is one of the post-COVID sequelae, chronic fatigue syndrome, which leads to body aches, joint pains. 2 or 3 things that we ask our patients to do. One is, don't be very aggressive in going back to the gym or going back to aggressive exercise. There have been sudden cardiac deaths because of people suddenly becoming too aggressive after recovering from COVID. At least give 3 to 6 months for recovery to happen, because COVID is not only a lung infection, it causes significant systemic involvement. It causes inflammation in the blood vessels, what we call endothelitis. It predisposes to clot formation, and therefore gradually start increasing your activities. Do gradual yoga, some degree of medication, and improve your diet and get regular sleep. Once you do that, over a period of time, gradually your fatigue will become all right. But don't try and be very aggressive in terms of exercise. Sometimes that can be counterproductive.
Thank you, sir. One more question from YouTube viewer. He says that 2020 onwards, what kind of disease affects the children with disabilities and early childhood cancer symptoms?
So from 2020, there have been many issues that have happened in children because of isolation and staying at home. So we are seeing more of mental illnesses, and especially in children who have had disability, because their social interaction has become less. But along with that, because of various lifestyle modification, we are seeing more of childhood related problems in terms of non-infectious diseases. And like you said, even cancers are being seen more commonly in that age group.
Yes, sir. One more, Monica has asked online, please ask sir about the post-COVID effects in kids. Kids are catching cough and cold very frequently, sir.
So with COVID, there is also what we call a decrease in your immunity for some time, and you are more predisposed to getting cough and cold. COVID also leads to what we call hyperreactivity of your airways. If you have COVID, sometimes the trachea and the upper airways become inflamed, they become swollen. And then whenever there is an exposure to sudden change of temperature, exposure to dust, fumes, the person starts having a cough and cold. And therefore, a combination of COVID, air pollution, change in temperature, all actually lead to persistent cough. And therefore, you have to take some degree of precautions in terms of avoiding the exposure, and some symptomatic treatment usually helps. This is not recurrent pneumonia, so repeated antibiotics are not usually required.
Sir, thank you so much, sir. Just 1 or 2 questions. I'll request my additional secretary, Dr. Suren Singh, who is over here, and our financial advisor, Dr. Thakur, he is over here. So, sir, they will also pose a couple of questions, sir. And after that, we'll finish the session, sir. Dr. Suren Singh, sir, over to you, sir.
थैंक यू अर्चना जी. एंड सर, ये आपका लेक्चर बहुत अच्छा रहा सर, और ये लाइफस्टाइल और बहुत सिंपल जो आपने तरीके बताए हैं, हालांकि हम जानते हैं लेकिन उसको प्रैक्टिस में नहीं लाते हैं, और आपने जिस तरीके से उसको पूरा कंसोलिडेट करके और उसके सारे पहलू बताए हैं, और ओवर द लास्ट 200 इयर्स कैसे सिनेरियो चेंज हुआ है, सो वी आर वेरी मच थैंकफुल एंड ग्रेटफुल सर. सर, जस्ट एक छोटा सा मेरा आपसे क्लैरिफिकेशन लेना चाहूँगा. आई हैव बीन COVID, I suffered through COVID few months back, maybe 5-6 months back. तो अभी क्या होता है कि कभी-कभी मुझे अचानक से लगता है डस्ट एलर्जी या उस टाइप से कुछ होता है, और आधे घंटा या 1 घंटे के लिए कफिंग और इवन जो जुकाम जैसा फीलिंग, वो आधे 1 घंटा जाता है. तो शुरू में मैंने कुछ मेडिसिन लिया, लेकिन मैंने लेने छोड़ दिया. वो 1 घंटे में ठीक हो जाता है अपने आप. लेकिन ये कभी भी हो जाता है, हफ्ते 10 दिन में, 15 दिन में, या फिर कभी विद मोर फ्रीक्वेंसी, और कई बार रात को भी हो जाता है सोते हुए. तो इसको we have to live with it or it will go by time?
तो जैसे आपने कहा, बिल्कुल सही कहा कि कई लोगों में जो कोविड है, स्पेशली जो बाद में कोविड हुआ है ओमिक्रॉन वेव के दौरान, उसमें जो है ज्यादातर सांस की नाली पे असर पड़ा है। ओमिक्रॉन वेव में लंग्स के में इतना असर नहीं पड़ा, जैसे हम पहले डेल्टा वेव में देखा था कि बहुत लोगों को निमोनिया हुआ, ऑक्सीजन की जरूरत पड़ी। ओमिक्रॉन जो वायरस वेरिएंट था और जो वैक्सीनेशन हमें लग चुका था, उसके कारण जो इन्फेक्शन हुआ कोविड से, वो सिर्फ सांस की नाली में ही सिमट कर रह गया और वहां पे सांस की नाली में सोजिश हो गई। तो जब आप कोविड से रिकवर भी कर जाते हैं, वो सोजिश या जो हम कहते हैं एयरवे इन्फ्लेमेशन, वो खत्म नहीं होती, एंड दैट मेक्स द एयरवे मोर सेंसिटिव। सांस की नाली थोड़ा सा ज्यादा सेंसिटिव हो जाती है जब भी कोई एक्सपोजर होता है। जैसे आप गर्म कमरे से आए और एसी के सामने बैठ गए, ठंडी हवा आपके सांस की नाली में चली गई, तो एकदम वो एक ट्रिगर बन जाता है और उससे खांसी शुरू हो जाती है। धूल है, धुआं है, झाड़ू लग रहा है, किचन में तड़का लग रहा है, उसका स्मोक है, धूप है, अगरबत्ती है, वो भी अगर आप थोड़ा सा भी इनहेल करेंगे तो आपकी सांस की नाली जो अभी सेंसिटिव है, उससे एकदम जो कॉफ का स्पैज्म है, बाउट ऑफ कॉफ शुरू हो जाएगा। और कभी कभी लोगों को ये लगता है कि कुछ गले में फंसा हुआ है और वो खांसी करके उसको निकालने की कोशिश कर रहे हैं। ज्यादा तकलीफ हो तो हम लोगों को एक इनहेलर कुछ दिनों के लिए लेने को कहते हैं, जिससे वो सांस की नाली की सोजिश कम कर सकता है, लेकिन ग्रेजुअली विद टाइम इट विल गो अवे। मोर इम्पॉर्टेंट इज प्रिवेंटिव एस्पेक्ट, कि एक्सपोजर हम अवॉइड करें जिससे सांस की नाली में जो सोजिश है वो आस्ता आस्ता कम हो जाए। सो एक्सपोजर टू डस्ट, फ्यूम, सडन चेंज ऑफ टेम्परेचर, स्ट्रॉन्ग स्मेल, हम कुछ टाइम के लिए अगर अवॉइड कर पाए तो फिर ये खांसी आस्ता आस्ता खत्म हो जाएगी।
Thank you, sir. Thank you very much.
Our financial advisor also has one question. So over to you, sir.
Namaskar, sir. It's a very good to hear from you. और आपने इतना अच्छा ये टॉक इलेबोरेट ग्राफिक प्रेजेंटेशन दिया, और आपने ऑलमोस्ट, मुझे 3 बार कोविड हुआ एंड फर्स्ट टाइम आई हैड बिगर प्रॉब्लम, स्टेरॉइड वगैरह लेना पड़ा। जो कुछ क्वेश्चंस थे केवल, अब कभी कभी बॉडी एक और थोड़े जॉइंट पेन्स होते हैं अभी, बट योर प्रेजेंटेशन हैज क्लियर्ड एवरी डाउट्स एंड वी मस्ट टेक गुड केयर ऑफ आवर हेल्थ। एंड वंस अगेन थैंक यू वेरी मच सर, जो आपने अपना बेशकीमती टाइम निकाला and enlightened us. Thank you, Archana ji, also.
Thank you, sir. And I must make a mark that our viewers have remarked this lecture as inspiring, nice, excellent, viewing again and again, and would be reinforcing UGC to arrange these types of lectures. So it's coming on YouTube. It's not my words, sir.
Thank you.
And one quick question from my side too, Professor Guleria. Sir, what is the secret of your health, sir? You were live throughout the COVID when the whole world was drooping down, sir. So, you know, from our side, from UGC side, what's the secret of your health? And after that, we close, sir.
Okay, I think Dr. Chauhan also is raising his hand. Maybe he can ask a question also. But I think the secret of my health is the same, that you have to maintain a good lifestyle,
Right,
and do some meditation, do some yoga, and just be dedicated to your work. I think I didn't get much time to think about being ill because I was too much involved in doing my work. But it's important to have a positive frame of mind.
Yes, sir. So, but I know you for last 25 years when I was working as a scientist in JNU, and you were there, sir. And you are the same what I saw 25 years back and now also. So, you know, big thank you to you. And Dr. Chauhan has one question, sir. Yes, Chauhan ji, please.
Sir, I am really happy, and I thank you that you have explained each and every issue very nicely and in the interest of even the common man, sir. I also affected by COVID last time, and hardly I save. And in the meantime, I see that during the COVID period and after the COVID period, I see that cough is one of the biggest issue, and that is dry cough. And it takes time, sir. And ultimately, so many, you see, sir, medicines has taken, and ultimately, by breathing long and by yoga, I recovered myself, sir. And I am really happy that one more important things come in my mind, that pure water is also essential for the humanity, because it is also one of the major cause for several diseases. I am happy that, sir, you have touched each and every phenomena of each and every disease and how it reacts, and the latest disease that is coming in the 21st century. So I really happy, sir, that you cover each and everything, and I shall be happy if all your slides may be available to all of us, and it will help in future as well, so we can contribute in the society. That your lecture is very important, because the entire country feel proud on you and your leadership in AIIMS. I am happy that entire my family doctors are from AIIMS and settled in US. My own niece and my another son of my elder brother, sir. So thank you very much, sir. And I'm really feel proud on your leadership, that we enjoyed your good lecture, sir. Thank you, sir.
Thank
So
you.
nice of you, sir. And thanks our honorable chairman UGC to invite you, and Archana ji to invite you. It is a really very fruitful lecture, sir. So nice of you, sir. Thank you, sir.
Thank you.
So now, sir.
I can see one hand that has been raised by Professor Pant.
Yeah, sir. Professor Pant is the Vice Chancellor of Assam University. So, very quick question, please, sir.
Sure, Chairman. Namaskar, sir, and it was really wonderful listening to you, sir. एक specific question मेरा है कि like I'm from Northeast, and in states like Mizoram, and I came across a very strange system in Mizoram. Mizoram is basically the smoking capital of the country, and large number of people are suffering from this cancer there. And उसका थोड़ा सा traditionally भी tradition से हम link पाते हैं. वहाँ पे क्या कि as children grow, I mean parents send them to field and they say now you are big enough and go to field and smoke. क्योंकि वो सोचते हैं कि शायद insects वगैरह वो जो उनकी खेती जो है उनका agriculture बचेगा इस system से. तो वहाँ पे ये I found this is very strange कि now you are big enough to smoke and go and smoke in the field. सर इस तरह के लिए क्या आप कोई special program आपके direction में कुछ कर सकते हैं सर?
Bilkul, I totally agree with you that there is a huge issue, because in many societies, smoking or use of tobacco is considered a norm. I remember many years ago, I had gone to one person, a very important minister's house from UP. And after the dinner, they offered pan with tobacco. And I refused and said, agar aap pan or tobacco ke saath pan nahi khaoge, to bura mana jata hai. It is a culture that in UP and all, that you must have pan with tobacco as part of any dinner that you have. So we have to increase awareness. Northeast has the highest number of cancers that we're seeing. A lot of activity is being done by the government in forming a cancer grid there with support from Tata Cancer Institute and others. But I think it's very important that we focus on prevention. More than 60 to 70% of cancers are preventable. And for prevention, use of tobacco, smoking, hygiene, and screening is important. So I think एक campaign चलाने की जरूरत है कि लोगों को समझ में आए कि इसका नुकसान ज्यादा है, और जो हमारी कल्चरल हैबिट्स हैं, जो सोशल हम सोचते हैं कि ये ठीक है, they can be more harmful. And I think Northeast में करने की बहुत जरूरत है, because there are a lot of issues there which are related to tradition.
Right. So we are doing it, and we'll do it now with greater zeal. Thank you very much, sir.
Thank you.
Thank you so much, sir. Thank you so much for being with us. And once again, I take this opportunity to thank you from the side of Chairman, Secretary, who are still in Ministry for important meeting for next week, sir. So I take this opportunity and take also this opportunity that we'll invite you again and again for our audience, sir, because we need your guidance on health for higher education institutions, always, today, tomorrow, and forever, sir. So a big thanks from all the UGC family and all of us, sir, all the officials, all the staff of UGC who are watching throughout India and also in the New Delhi headquarters, sir. A big thank you to all for staying with us for 1 hour, sir. And we have no words to express your gratitude for, spending time with us. Thank you so much, sir. Namaskar, sir.
Thank you very much. My pleasure. Thank you.